Our next guest is a former athlete and used to going through life at full speed, but the many years of physical activity has started to take a toll on his body. We heard of a revolutionary treatment to relieve his pain, so what do? We put it to the test. Here's his story.
As a professional tennis player, a typical day would consist of waking up, going for a run, playing 2.5 hours, back on the court for another 2.5 hours, sprint work, and resistance training. I ran 2 Boston marathons, so a lot of wear and tear on the body. And I've had chronic pain since my mid-20s. In my hips in particular, recent MRI showed that I have degeneration in both hips, arthritis, bone spurs, impingement, and cysts around both hip joints. Kind of scary to hear myself say it. I'm very stiff. Getting in and out of chairs is a painful activity for me.
Paul came to see me because he's been told that he needs hip replacement surgery. He wanted something that's less aggressive. So now we're gonna get ready to centrifuge, spin the blood so we can separate the plasma. APK2M is an injection procedure that stops the progression of arthritis by using anti-inflammatory factors in the patient's blood. And now we're gonna draw the plasma. It helps restore the joint and allows for pain relief that can last up to 1 year. As you can see on the ultrasound, that is the hip joint. Paul's gonna feel a little stick, and we're in the joint space. We're injecting the A2M into the joint space. And that's it.
Please welcome Dr. Sammy Masri and his patient Paul to the show. Paul, how's the pain doing?
It's gone.
Really? Wow. You're ready for a 5-set match?
Yeah.
Yes?
Wow.
I'll tell you, before the treatment, I had about a 40% range of motion in each of my hips, and I tested out at about 100%.
How long ago was that, the injection?
Oh, I guess several weeks.
Several weeks ago.
But the result was immediate.
Dr. Masri, tell us about the A2M injection. What makes it different?
Well, the A2M injection has particles in the blood that you have anti-inflammatories that we're able to inject into a particular joint that's arthritic to reduce the inflammation.
So are we talking pretty much any joint in the body, theoretically?
Any joint in the body, anywhere there's inflammation, you can actually use it on soft tissue such as tendons and ligaments, but it's mainly done for joints like shoulders and hip joints. You know, Paul's been told that he needs a hip replacement, so as long as we're able to give him some time for him not to have the surgery, to prevent the surgery from having any sooner, you know, we're able to actually go ahead and help him out.
And
I want to ask, does this stand in terms of the menu that PRP,
yeah,
where we inject hyaluronic acid lubricants into joint spaces. Steroids was the go-to anti-inflammatory back in the day. Put all of those different treatments in perspective, and do you still use those? Or is
yes, we do. The difference between PRP and stem cells, PRP and stem cells are more for regenerative of tissue. This is more, it's more of a steroid. It acts more like a steroid in terms of the anti-inflammatory properties. It gives you a little bit longer time than a steroid. Typically, a steroid shot acts for about 4 to 6 weeks. This can give you up to a year in regards to pain relief due to the inflammation that's in the joint space.
And is this a typical patient response?
Yeah, it's about 92% based on studies that they've done with the A2M company.
I'll be in next week. You can inject every joint I have. Sounds good. Thanks for sharing this with us, Paul. Happy you're feeling better. More to come, everyone.